Here we are. Well, thanks for coming on the show.
Yeah, you're welcome. Glad to be here.
Yeah, so why don't we kind of educate people about who you are and what you do? And I think people would really like to know.
Yeah, my name is Dr. Travis Whitney. I'm the founder of the Innate Healthcare Institute, which is here in lovely Phoenix, Arizona. So my background training is as a naturopathic doctor. I have a degree in medical research, and I have a degree in Chinese medicine. So I kind of blend all of that into Innate Healthcare Institute and try to make it kind of like a one-stop shop for healing.
That's awesome. I know for people that are listening or watching right now, Dr. Whitney and I went to school together when he was studying Chinese medicine, so that's how we met and conveniently became good friends. And I said, hey, we should just kind of have a chat together, because I think we take for granted, before we started recording, I said I think we kind of take for granted some of the conversations we have, that maybe people would actually like to know some of this stuff, so yeah, I think, honestly, I don't even think you and I talked about the fact that you have a degree in medical research. Can you tell me more about that? I don't even know, like, we've never had that conversation.
Oh yeah. Sheesh. Actually, my thesis research actually just got published.
Congratulations.
Shows you
That's
how long,
awesome.
how hard and how long it can take for research, because I finished that back in 2015. Um,
Wow.
and it's in the Journal of Restorative Medicine, and it's the effective Qigong meditation on brain-derived neurotrophic factors, cortisol, and learning. So basically, this study looked at if experienced meditators could learn a new task faster than a non-experienced meditator. Is basically what it looked at. And there's a couple different ways we measured that. But that was the program. It was a master's program. I did it concurrently. So I was a dual degree student, is what we call us, where you're in two different programs at the same time. So I did that along with my doctorate. So I wasn't your normal med school student. I was also doing a master's. So what little time you had in medical school, mine was doing a master's degree with that little free time. So it sucked a good bit.
I bet.
But it was great. I enjoy research. Research has its place and it has its pros and cons. I think in the West, I don't have much to compare from other countries, but I know here in America, we are very, very research driven, it seems.
Yeah.
Even your common like layperson that's not in the science or health field, you'll hear that a lot now. I think social media has ramped that up a lot too. Is like, well, what's the research on that? Is there any research? I really, really enjoyed learning the ins and outs of what it takes to do like real scientific research, or how to make a really good study if you're just doing like a survey study, or are you doing like a double-blinded placebo-controlled study, and everything in between. So it was a great program. They were very very nurturing. I've talked to some other people that have done research programs, whether it's at the master's or PhD level, and a lot of times you don't get to pick what research you do, which kind of blew me away. You often get handed something, and it's like, this is what you're going to do your dissertation or your thesis on. So we got to kind of got to pick our research that we were passionate about, which was a great part of the program. Mine, I went way over the top, as is usual. So I had to scale my original research down a lot, because I'm like, y'all don't have $1 million to give me to do research? What? So it's a great program. We were actually I was part of the, I think, second graduating class from that research program, and it was a master's in integrated medical research. So again, it focused more on integrative kind of medical research. Hence mine, with meditation and measuring different growth hormones and hormones in our body and applying that to how well somebody had neuroplastic changes or how well they could develop the task of learning and ability.
Okay.
But it was still intense. We saw it do like biostatistics, which is probably the worst classes I think I've ever taken. Even people that are in biostatistics hate biostatistics courses. So yeah, it was pretty grueling. Any free time that I had for med school was just gone. It turned med school from like a full-time job into like a full-time job and having a part-time job on top of that. So it was really exhausting. But yeah, really cool, interesting program. Opened my eyes to research. Now I read research better and more coherently. I can pick and choose like what's good research when I'm picking apart research studies, which has become a part of my day-to-day job. And a lot of people don't know how much in medicine, how significant that is.
Yeah.
Yeah.
That's so interesting. I mean, I think the closest exposure I ever got, well, first off, I hear you on the statistics. I took statistics when I was in undergrad, and man, that was rough. Even my statistics professor was like, well, you'll be a statistician and, it's all good, but it's still statistics.
Yeah.
But yeah, I ended up, I had just taken one course that was focused on research. How we would read scientific research. We learned how to do it better, and like I can only imagine like all that you learned about setting up experiments and research. I mean, I just got so much from one semester. I can't even imagine, going through a degree and setting that up. That's really cool. I'm sure that you can provide a lot of insight for a lot of people when it comes to how research works. So like, what are some examples you can give to people? Like, what could they do to read research better or more effectively?
There are some pretty decent sites. I think they're university sites that you can just skim, that you can read through, and it can tell you some big highlighting points on what to take away from a study, if it's good or not. Things like sample size. If you read a research study, let's just say you're reading something on a supplement, and it says it's good for this condition X. If they only use 50 people in the study, that's a lot of room for error. That means if you had another 1,000 people to try that on, that the outcome could have been totally different. So hardly one research study is hardly what we would call like good evidence. If you're just a person reading, us as like healthcare providers, we try to read as many studies as we can, or we look for big studies like meta-analysis, where researchers go and they take 15 studies that they find and they pick them apart and they say which ones are the best ones. They include those, and then they see this overall outcome of how well whatever supplement herb X would be for condition X.
Yeah.
So there's some really good things, sample size. I think study bias is another one, which is kind of hard. Usually you have to search for the fine print. You want to see like, where the research is being done, and then you want to see who's paying for the research to be done.
Yeah.
So that one could be pretty tricky to find. You want to make sure that when you're reading something, like it's exactly like what you're looking for, which I know when I got my undergrad, I think I was a little guilty of that, which was in psychology, which was pretty heavily research focused. And trying to think of an example for that. but like sometimes people will find outcomes, or they'll say like, oh, I read this study that this drug or this something is good for autoimmune conditions. And then you go in, you look into you read the study a little more, and you're like, oh, well, they did those on a rheumatoid arthritis patient, and what you're referring to is something for multiple sclerosis. So it's not like the best comparison, where you could go find a research study that is specifically focused on multiple sclerosis. So it's best to learn how to read a research study and make sure it's applying to exactly what you want to apply it to.
Right. That makes sense. Yeah, I remember, I took that class in undergrad, and then I started, it was probably like halfway through, and then I started diving into research more, and then, I ended up publishing a large, somewhat large for undergrad, paper on the effects of Olympic weightlifting. And then I would just go into all the research and find all these different things on Olympic weightlifting, on humans and everything. And it's like sometimes I think something people don't realize is you can literally make research look however you want when you're publishing something in mind. Like, for example, for that paper, I was like, okay, I want to see the effects of Olympic weightlifting. I personally saw two different ways that could have gone. Coming from a coaching perspective with that, it's kind of like, you could search for injury data, you could search for, physiological differences that occur. It's like you could take it in so many different ways. And I was like, wow, my research is way too big right now.
Yeah, you got to be careful what outcomes or what conclusions you draw.
Right.
Like for me, so like my specialty is stem cell medicine.
Right.
That's so broad. When we talk about stem cell medicine, are you talking about bone marrow derived stem cells, adipose derived stem cells, cells from umbilical cord blood or tissue? So there might be a study that says bone marrow derived mesenchymal stromal cells helps with knee osteoarthritis. But if at my clinic we're using umbilical cord mesenchymal stem cells, which they both work great, that doesn't necessarily mean that translates. You really have to make sure you're defining your criteria very specifically. And I've seen some places do that, or even some researchers or doctors say, well, this study is saying this, and then I'll go and look at it and be like, that's not exactly what that study is saying. I thought of an example, but I won't call a guy out on him. But yeah, so it helps. It's helped me have a good, really firm grasp of doing research, reading research, the time and money it takes to doing research, a whole new different level of respect for, and not jumping to conclusions really quick when you read a research article or something, and you're jump to using this for a patient,
Yeah. Yeah. And, I think, because you also have a TCM background. For those of you that don't know, that's traditional Chinese medicine. And I think that's something that we run into a lot when it comes to research, is because, there's this understanding of kind of these other elements that are hard to measure, such meridians and acupuncture points and qi and all these different things, which we have different terminology for and different understanding for. But, people say, well, where's the research? It's like, well, a point like pericardium 6, that's going to be a really tough one to narrow down, because there's so many different things happening. So thankfully, we've been able to narrow like pericardium 6 down for like nausea for cancer patients, like something really specific. But we don't really ever talk about like the spirit calming effects. So spirit calming being like anti-stress effects and things like that. And I feel like that's that's a big place to play where a lot of assumptions can be made. And like you said, the research and the money takes a lot of time, a lot of
Yeah.
effort. Um, and I mean, I completely understand. I even look at like the presentations that I make, like when I'm teaching students or classes or whatever. It's like, man, this takes me like so long to create this, let alone try to make a scientific study to actually publish research. And the conversation that comes up all the time, because I want to touch upon something that you mentioned with uh, looking who's sponsoring that study. I mean, I pretty much not every time, most times, um, researchers claim no bias, right? It's like no bias. Okay, great. So we're clear. And a lot of people will stop reading there. And then it's like, oh, if we had a study that said Pepsi's good for you, and then we see who that Pepsi was the one that paid for that research, it's like, well, of course they're going to find a way.
Right. And it should raise a flag. You should be like,
Yeah.
definitely, this is on the weaker side of a research study. That like this is going to be a weak study. I should probably take these findings, whether significant or whatever, with a grain of salt, and let me go find a couple other studies, hopefully from non-biased sources, third-party sources or something, and then I'll make up my mind.
Yeah. And I think that's a good transition, because I know you touched upon your how you really specialize with stem cells, and I think stem cell therapy is another one of those things. There's so much room to play for people who may not specialize in it, who don't fully understand it, and so where do we even start when it comes to stem cells and what you do in a day? Like maybe even start like, okay, what is a stem cell? Where does it come from?
Yeah, so again, that kind of piggybacks on us talking about like defining what exactly it is we talk about. We have this umbrella term that's stem cell medicine, but then I think most people think like it's just one thing.
Mm-hmm.
Like how a lot of people might think Chinese medicine is just one thing. It's like, oh, it's acupuncture, right? Like I know a lot of people think when they hear naturopathic medicine, they tend to think homeopathy.
Yeah.
And it's like, that's it. It's like, no. So the same thing goes for stem cell medicine is, stem cells, we have stem cells for every tissue in our body. So when we say stem cell medicine, we're usually referring to extracting a certain type of stem cell from a certain tissue source and using that for a therapeutic purpose. The earlier types of stem cell treatments were mostly post chemotherapy. So, a cancer patient would go through chemo. They would extract the patient's bone marrow and use what's called a CD34 positive, which has a more correctly named a stromal cell. And they would use that to repopulate like the red blood cells and the white blood cells, because the chemo would wipe it all out. I don't know why they didn't do that with every patient. I guess I don't know why they do a lot of things, but so that's another type. And then there's adipose. You can suck the fat cells out, and you can harvest those to make a certain kind of get a stem cell from that kind of tissue. And so then we break it down into the autologous, which is a stem cell or a cell coming from that person, or an allogenic, which is a cell or something coming from another person. I've mostly been in the field of allogenic, so using things like umbilical cord tissue, where you take a donated umbilical cord, or it could be that cord from that same person or from their family. You break those down. Well, first they test them for like safety. They test the mom, they test the cord for certain diseases, like very obvious communicable diseases like HIV, syphilis, Zika virus. I'm sure one day they're going to do add COVID to that list.
Yeah.
But a whole kind of different diseases. And if it's good, that cell or that cord basically gets broken down until you get a very specific cell type. They have to have very certain receptors on that cell to be classified as a mesenchymal, or sometimes you've heard of them as mesenchymal stem cells. So those cells are kind of like master healing cells in our body. They do a great job at fighting off like infections, at healing wounds, at stopping inflammation. The problem is that sometimes it's not a perfect system. You know, our bodies aren't perfect little machines. And with age and chronic illness and stress, our bodies, our number of these cells deplete over time, which is one of the reasons they think, like longevity experts like Dr. David Sinclair at Harvard and others think that's why you're kind of susceptible. The more you age, the slower you are to heal, the more susceptible you are to diseases. There's a whole bunch of reasons, but one of them is that we lose these type of cells. So people like me do is take them from a younger source, grow them, and use them to inject in a knee joint if they have arthritis. You can put them intravenously, you can inject them intramuscularly, you know, just like a vaccine. And they work really great on the immune system that way. You can put it intrathecally. Some people put it into a spinal cord, which is a little risky. I don't do that. I pioneered some other delivery methods, like an intranasal delivery, so that you get better access for the cells to your brain. So it really comes down to some clinical decision making as to what you're treating, what your goal you're trying to accomplish, stuff like that.
Okay, so I want to make sure I'm getting a grasp on this. So you're primarily using, I forget the term you use, the cells from another source. What was the term for that?
Allogenic.
Allogenic. And
Yeah,
that's what you're primarily using,
from
correct?
somebody else besides the patient.
Okay. So if you're focusing on allogenic, what's the process like? All right, if someone gets it in their nose versus gets it in their knee, like why would someone get it in their nose versus their knee?
You want to target the specifically the tissue, the target tissue you're trying to fix the most. I guess so. Yeah, just say you're working on it, you're trying to fix the most. So stuff like autism, dementia, any neurodegenerative disease. You know, you want to get as close to your target tissue as you can. And there's a little nerve and blood vessel bundle back here in the middle turbinate. It's called the sphenopalatine ganglion. There's another anatomical term for it. I forget what it's called. But a sphenopalatine ganglion, it delivers medication, if you want to call it medicine, up to the brain really good. If you have somebody with a migraine, a lot of neurologists do this treatment where they'll put like 1%, 2-3 cc's of 1% lidocaine, and you can either do it with a catheter, threading a catheter back there, or there's little atomization devices that turn whatever your liquid you have into a spray. You put it back there, and that migraine will be gone in like 2 minutes.
Wow.
You know, of course, I don't think it works every time, but so there's a lot of good evidence that stuff delivered into this bundle of nerves and blood vessels gets up to the brain really well. And I see that with treating autism patients, with treating dementia, treating even mild cognitive impairment, memorization better, starting to learn to talk better in kids, a lot of cognitive functions improving. Versus the knee, you know, if you have knee pain, stick it in the knee. Don't go up in the nose.
Okay. Yeah, I mean, I try to think of questions that people may, think of, like, okay, so if we're taking those cells, we'll just use knee versus nose, those are created differently, correct? Or those are created the same?
No, you can use MSCs. We'll just call them MSCs for short, mesenchymal stem cells. They're good utility players. They can play a bunch of different positions on the team.
That's awesome.
So it's hard to determine like what they're going to do, and that's part of their genius once they're in the body, is that they pick up on environmental signals and they know what medicine to make, or they know what cell to turn into. So if you inject them into the knee, their differentiation capacity is to turn into chondrocytes. And you can see this on post MRIs. You can see more cartilage or connective tissue, usually 36 months down the road after a knee injection. So you can do that. You can do some manipulation. You can turn these cells into chondrocytes. That way they're already chondrocytes, so that when you inject them in the knee. But I just love how good of utility players just a good old-fashioned MSC is.
Yeah. Yeah, I think that's so fascinating when you think of MSCs. When I try to relate that to Chinese medicine, I know I've talked to other professors about this. It's almost like MSCs could be this unknown player to like replace Jing in a way, or like bring Jing. You know how we talk about the concept of Jing being like you get this much, and then as you age, it's just depleting over time, over time, over time. And in a way, it kind of seems like stem cell therapy could be that thing to prevent that decline or potentially reverse it. If an MSC can turn into chondrocytes for someone who's dealing with knee issues, that's a really big deal, because I think of other injection types. I know that there's a lot of synthetic joint injections, or create padding between the bones and everything because the cartilage is breaking down or broken or whatever. But the fact that an MSC can regrow, that's fascinating.
Yeah, I like the Jing analogy, because there's been some really cool research on frailty in the elderly, and administering a certain, I think the group that saw the best was 100 million cells per month. And they recorded stuff like, how well they walk, how well they moved, how strong they felt in this elderly population. And against placebo, it was a very well done research study, and it was very, very significant outcome that the stem cell group did way, way better. So I think we'll see that. Hopefully, we'll see that. The FDA has a weird stance on stem cell therapy. I don't know. So I don't know how long it'll be for it to be commonplace. It should already be commonplace because it's so safe. The safety studies have been numerous for years now. But I think something like East meets West is going to merge, where we see like stuff like Jing, where we give herbs and stuff. You're trying to like restore this person's constitution and like their vitality, right?
Yeah.
That's what is a strong possibility of MSC therapy in the future.
Yeah, and that's really interesting, that word vitality. I am under the impression, with people I've trained with, people I've worked with, et cetera, people I even talk to about, vitality. Everyone wants vitality. And, I find a lot of, athletes, and for those of you that don't know, yes, the athletes do this all the time, with a real focus on testosterone, just injecting testosterone. What would you say, for people who don't know much about this stuff, what would you say in response to testosterone versus MSCs for vitality? What do you think?
I have a colleague that measured, he measured a bunch of different biomarkers, but he measured hormones in his patients that he gave exosomes, which is, it's kind of the same as stem cell therapy. Exosomes are the medicine that stem cells make. If you look up exosomes, EXOSOMES, it's basically ways that cells communicate, not just stem cells, like all cells in our body. So he did a lot of exosome therapy, and he measured testosterone. He saw testosterone go up in a lot of his patients that were doing frequent exosome doses. I think he like cured a COVID patient using exosomes, and the government kind of ran him out of medicine. It was really sad. So I don't think he does it anymore, because they said he was using it as a drug at that point. So I think he might have gotten in trouble. I don't know, but I don't think he practices it anymore. But he saw testosterone go up. The big difference is testosterone is so available, and it's so easily either synthetically compounded or as a bioidentical hormone replacement. It's so much more inexpensive, that testosterone therapy is going to be more of a go-to than MSC therapy is. If you're just talking about increasing testosterone levels. But that's what my envision for medicine is, a very personalized approach. Because there's a lot that MSCs do that testosterone can't do. And so if you have somebody that is hypogonadal, if they are very, very low on testosterone, then, and there's other problems that MSCs could address, why not give both? Why not do both, and along with other stuff, and make it as personalized as you can for that patient. And that's my big emphasis in the clinic, is everybody's not the same. Everybody doesn't need to be treated the same. Everybody reacts differently to different medications, whether natural or pharmaceutical. So don't treat everybody, what's the term I'm looking for? Don't, it's not a revolving door when it comes to patients coming to your clinic.
Right. I know this is kind of a subject we've talked about in the past. What about drug tested athletes when it comes to MSCs? What's the deal there?
I have no idea how you would measure. How you would measure, like, if they're even on MSC therapy. There's no way. Athletes do it, I know for a fact. I'm not going to sell anybody out, but I treat them. And I know for a while, years ago, it's getting more popular in the States, but years ago, athletes were going over to like Europe and stuff to get it done. Get their joints, whether it was an injury, or they're just trying to stay on top of their game. They go all over the world. So yeah, it's being done. It'll be done a lot more.
Yeah. So, well, it's kind of this play. I think there's some people out there who don't understand what an athlete, or especially a professional athlete, really has to go through to stay at the top of their game. And they'll do just about anything. That's their livelihood, and I try to stress that, like, this is someone's livelihood we're talking about. It's the matter of having a job and not.
You're talking easy 6-figure job to millions. To making millions, and they do what it takes to stay on top of their game. You're a high level athlete. I'm getting back into baseball, and I'm trying to build a baseball body, and it is extremely excruciating on my 40-year-old muscles and bones. And I sprained my ankle. I told you I sprained my ankle a few months into this season earlier this year, and it took a while to heal. It's taking a while to heal. I put stem cells in my ankle. And that was a huge game changer. So I'm just now getting back into playing, or practicing, stuff like that. So those guys at the top of their game or trying to get, to the top of their game, it's definitely an option for them.
That's like gonna be there's alarms that are gonna go off when people hear this. They're like, wait, I can do this and it's essentially legal. I think that's revolutionary, honestly. That's huge.
Yeah. I wonder if one day it'll be, banned, like it'll be on a banned list or something, like
Yeah.
no stem cell therapy.
Yeah.
Huh.
It's just it's something I've thought of that's like kind of at the forefront, but it's not. It's kind of this arms race when it comes to, and you'll see that a lot with Olympians too. I mean, a coach I used to work with, she was an Olympian. She was an Olympic weightlifter for Mexico, Luz Acosta, and it was several years later, but she actually got a phone call. She was in London in 2012. She actually got a phone call. She said, and they basically told her, hey, we went back with newer technology and tested the samples we had from these other athletes.
Mm.
And as a result, she ended up getting a bronze medal because these other athletes had tested for a compound that they weren't able to track at the time.
Oh, wow.
So she ended up actually getting a bronze medal for Olympic weightlifting from, I think it was London 2012. And that was like a huge deal. I mean, so it makes me curious. It's like, well, if these cells, these MSCs become, your own cells, it's almost like the point if we take something like, blood doping, or if someone just takes their own blood, it saves it and puts it back to themselves. It's like, how, like, that's hard to figure out,
Yeah,
so.
yeah, totally. That'd be some interesting research. If there's any athletes out there watching, give me a
Yeah.
call. I'd love to do that and see, measure maybe subjectively and objectively how much it's improving, maybe like lean muscle mass, or maybe somebody's burning fat better, or just increasing their gain or their strengths on MSC therapy. Me as being medically oriented, I'm fixing stuff.
Mm-hmm.
I get patients that are very proactive in their health, so they don't have a lot going on with them. They just want to keep it that way. So it falls into more like an anti-aging kind of a realm that people are doing this kind of medicine for, and the other stuff that I do. But yeah, I don't athletes. I've repaired them, but I would love to just start working on some that are like, hey, you want to see how much this can increase your gains? Give it a shot.
I think that's so fascinating that I think there's a lot of avenues open for that potential.
Mm-hmm.
It sounds like, and there is something you mentioned before, and I don't want to overlook it. Knowing what you do personally, obviously, why don't we tell people about your clientele? Because I know you've done a lot when it comes to autism, and autism being such a, from what I have understood, as being a huge, you've had a lot of people reach out to you for that. Would you say that's kind of, aside from people trying to be proactive about their health, is this another big focus that you have in your practice?
It's the biggest focus we actually have. I would say we treat on a patient base in terms of volume. I'd say autism the most. Close behind that is orthopedic conditions, osteoarthritis, sports injuries, stuff like that. Shoulder, back, knee, ankle, wrist, elbow. Any kind of joint condition. Then behind that, I would say would be kind of like infectious disease, autoimmune component, Lyme's disease. Is it an autoimmune disease? Kind of these people that are are stuck in this. We kind of don't know what it is.
Mm-hmm.
So I get to see a good amount of those. But yeah, autism it has gotten up there, especially over these past couple years. It's, we did this interview 3-4 years ago. I would have told you I do injections all day, every day. That's all I do. Inject the knee, I'll go another room, inject somebody's back, I'll do a shoulder. It was all orthopedic. And now I do a lot of autism, a lot of GI health, a lot more labs and stuff like that. So autism responds great to stem cell therapy. Autism is a little bit of a mix. It's a neurodegenerative condition. It's an autoimmune condition. It's an infectious disease condition. It's an environmental toxin condition. It's almost some of those in some sort of spectrum. And I know a lot of the research says that vaccines don't cause. And speaking of bad research, that was one. I think his name was Andrew Wakefield, made that falsified that study and said that vaccines cause autism. I think that was the one. Yeah, he got banned from research forever for it.
Because
It was MMR.
He said vaccines cause autism, or they don't.
He made a whole research study showing like how the MMR vaccine like caused autism or something.
Wow.
Sure, unless I'm confusing it with something else, but a lot of research out there says that vaccines don't cause autism, and and I'm not discrediting any of that research, but I would make an asterisk and say, all right, well, it's not causing autism, but it sure as hell contributing to autism in some way, because out of hundreds of parents I've talked to, so many of them have the same story. Their kid was developing right where an 18-month-old should be, talking, eye contact, socializing, stuff like that. And then within a week to a month after usually that 18-month vaccination schedule, you'll hear, I lost my kid. They stopped talking. They stopped making eye contact. They stopped engaging with us and other children or their siblings. Bowel movements mess up, like usually constipation, sometimes really bad diarrhea as well. So you can say what you want, but once you start talking to enough people saying, I had this kid, and then I had a vaccine, and then I had this kid, you know that is doing something, that vaccine did something to the immune system that caused it to go a little bit haywire, and then their developmental process went askew. There's not an autism kid that I haven't done what's called a quantitative polymerase chain reaction, a qPCR stool analysis on that hasn't had some sort of dysbiosis, either very, very low on good, healthy bacteria in our guts and or really high in bad bacteria, or sometimes parasites, and they have poor digestion. So there's always some sort of GI thing. Environmental toxins, heavy metals, those are hit and miss. Sometimes kids have some of that, sometimes they don't. Diet, we talk a lot about diet and what affects kids. Kids with autism, 90% of the time are very, 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 very selective picky eaters. Usually 5 things in their arsenal, and guess what? They're all big culprits for what me and you would think would be very inflammatory, of foods. Dairy, milk, cow's milk, processed foods, white breads, processed foods, sugars. I like fried chicken. I like chicken nuggets a lot for some reason. I had one little kid who would only eat, he was even picky about his chicken nuggets. He would only eat Chick-fil-A chicken nuggets. He wouldn't eat, like when the mom tried to buy like organic good chicken nuggets from like Sprouts or Whole Foods or something, like a grocery store, he wouldn't eat them. He had to have his Chick-fil-A. But so we try to approach all those different combinations because, we've seen parents that have been doing this stuff for years, changing diet, doing Doctor's X's supplement protocol, and they see little to no changes, and within a couple weeks to months, some of the changes they see are very, very dramatic after stem cell therapy. So we know that stem cell therapy is a huge game changer for them. Focusing on their gut health and these other things that we talked about is just adding icing to the cake. It just helps increase the chances a lot more.
So this is making, I'm following everything, but I want to backtrack a few things here to make sure everyone else is grasping this that ends up listening to this. So, this is a big statement where a lot of people will have controversy when it comes to vaccinations, especially in today's day and age with new vaccination technology out, mandates happening in places. Like, vaccine is the big word right now.
Yeah.
And so you're saying that, and you are mentioning research, and the common thread that you have found with the people you have worked with is a vaccination protocol?
Yes. That is, we say it like a correlation, right? Like correlation doesn't equal causation. You could correlate the amount of pickles one eats to, I don't know, like car accidents, in a certain area. That doesn't mean eating pickles is going to cause your car accidents.
Right.
I would say if I was on a debate stage and I had to go to one side that said vaccines actually have no effect on autism whatsoever, or the other podium of vaccines are definitely having an effect on autistic kids, or influence them developing autism symptoms, I'd go over here. I'd go to that it seems that autistic kids have significant onset of symptoms after vaccines.
Okay.
Yeah.
Yeah, and I know you've had a lot of clientele in this category, so that's really interesting because even before COVID-19 discussions, before COVID-19 vaccine discussions, there's always been that discussion of, well, does or could vaccines play this role in autism? And that's very interesting. I think that would be very interesting for a lot of people to hear.
It's not every parent, and I don't ask in such a way of like, he got autism after vaccine, right? Like that's when he developed autism. I gather their story. If they don't happen to bring it up and mention it, to kind of validate and gather more evidence, I say, when did you notice the symptoms come on? Did you happen to notice they were after a vaccine? In his vaccination schedule, you said they came on around 18 months. Were they right after vaccine? And some parents are like, no, I don't know. I don't remember that. I don't think it wasn't any time near a vaccine. It just kind of happened.
Okay.
So it's not every parent that says it, but it is a very high majority.
What's an approximate percentage?
80 to 90.
That's pretty high. Yeah.
Yeah, it's pretty high. It's pretty high. I should be better on my biostats and
it's all right.
record everyone that does, but speaking anecdotally, I lowball it. Let's say 80%. Let's say it's 70%. That's still way too high.
Yeah, that's high.
And the parents are very, very adamant. How do you tell a mom that they're inaccurate on noticing when their child developed autism symptoms?
Right.
They were kids were talking, kid was developing this way. They went, got the, their vaccines, and some said within a day or two, some say within like a week, maybe within a month, all these different symptoms kind of started setting in. So does that mean vaccines caused autism? No, but not necessarily, but it probably means that they're definitely playing a part on that kid's immune system
Right.
turning on like an auto-inflammatory or pro-inflammatory state. Yeah.
Yeah, I think, knowing your background and that statement, it really sounds like you're not trying to take a position. You're just kind of talking about what you've found and kind of what you
Yeah,
experienced.
I'm just reporting what I observe.
Yeah.
I've had colleagues and friends. I know I have somebody I went to school with. She was a few years ahead of me. I've seen her give presentations at more like naturopathic conferences, and I've seen her booed right off the stage for her saying there's just not enough evidence to say autism causes or the vaccines cause autism.
Yeah.
Just booing her right there. So you just kind of report what you're observing and finding. But you ask me at this day and time, I think vaccines, a vaccine schedule is contributing to the autism symptoms that they develop. It could be like a perfect storm kind of scenario where that child's genetics, their diet, their epigenetics, maybe they're sick, maybe it's the glyphosate, maybe it's like a high concentration of these toxins that they have in their body. The vaccine goes in, their immune system responds to the vaccine, goes a little haywire because of this over here happening, and all of a sudden you get regression in language. You get, they don't start developing neurologically the same way that they would. The immune system isn't responding as well, so they get a lot of GI infections that start making things worse and worse, and you just got this little perfect storm scenario that ends up happening.
Yeah, it's really interesting how you talked about some of the GI symptoms that go with it, because there's so much information on the gut-brain axis and the communication between the gut and your brain. It makes me wonder if what you're talking about, that, maybe in the case of a vaccine plan, maybe it's just throwing off their gut microbiome in a certain way at a certain time, kind of perfect storm scenario like you were talking about. I wonder if that is a place where, if if there was funding, if there was willingness, if that would be researched further, to be one area. I think it's worth at least asking questions like that to understand further.
Yeah, because if you don't look for it, then how do you know?
Yeah.
And if it's not on anybody's radar, then they're not going to look for it. Why does MSC therapy work so good for autistic kids? Why are there kids that are nonverbal and they can develop full sentences? Why do some kids' bowel movements become normal after stem cell therapy? So yeah, you got to state your problem and really look for it. And MSC therapy is definitely has been a game changer for autistic kids, for sure. Sleep changes really quick, and it's not only for the kids, it's for the parents too. Like when you have a kid that's all of a sudden sleeping really good and listening to you, understanding and comprehending what you're trying to tell them, their behaviors improve. Like that's a huge game changer for the parents.
Yeah. And just being able to sleep, and we understand in Chinese medicine, like how important sleep is too. We talk about it all the time, being essential.
Oh, yeah.
Just to all functions, and all science really understands the importance of sleep.
Oh yeah.
I don't think that's a question at all. Um, so, okay, if we have the scenario that, um, I don't know how people reach out to you necessarily, but say they find you, they set up an appointment. What does that look like? Say you have a child who's autistic, and the parents, maybe saw some of your research or heard about you. Um, what does treatment look like for those kids or patients?
So I know I do. I try to stick to like a 10 or 15 minute, just really quick talk to the family to make sure the goals are aligned, that they want to have done. Sometimes other kids have other genetic conditions along with autism. And so I just want to make sure they understand what they're getting to. Most parents are very, very pretty well researched in stem cell therapy. By the time they reach out to me, they do their own reading, they do their own looking it up and stuff. So they just want to know a little bit of ins and outs. But yeah, so usually I talk to the parents, sometimes for an hour. Just talk to them to explain the procedures, explain like expected goals and outcomes. I'd say 95% of them come from out of state. So logistically, we get them set up on when they're going to be here and for how long and stuff like that. We get the cells prepared. We go over other stuff. I'm talking about their diet, what that looks like, talking about the tests that we're going to run, like environmental toxins and stool analysis and stuff like that. If they haven't done those already, a lot of parents have already done a lot. They've been doing this stuff, for years. And stem cell therapy is kind of like, we didn't know we could do that, or, we didn't know that was an option, kind of a thing. So just a lot of educating, like we do, educating them, talking over, explaining the importance of diet, explaining the importance of their gut health and how important that could be for healing from here on out. And then the treatments are pretty quick. We do an intramuscular administration and the intranasal. So we delicately hold the kid while they get their shot in their shoulder. And then the intranasal is just, there's actually a little device, it's called an MAD, mucosal atomization device. And so it basically turns the syringe into a spray. So we put it up there and it sprays in to saturate that little bundle of nerves and blood vessels I was talking about earlier. And that's it. It's kind of a short and sweet little treatment. They don't like it. No kid likes getting a shot or anything. Every now and then on some of the bigger kids, I know a lot of other places around the world do intravenous. So they'll do it in a vein. I did that early on. It's really, really hard to get an IV into a kid that's yelling and squirming. So I found some really good research on IM, and I'd been doing IM for other stuff and saw how well it had worked. And so I started doing it on the kids, and it's just less traumatic. It works really good. So every now and then I'll only do an IV if like the parents kind of insist they really, really want it. But otherwise, yeah, it's a quick kind of a treatment. Then when we get the labs back, we tailor the treatment more for the kid on exactly what those labs are saying that they might need. If we need to chelate any heavy metals or environmental toxins, if we need to use like maybe some pharmaceuticals or some herbal medications to restore balance to the gut or improve digestion.
Okay, so it's really a lot more involved than just those injections. It sounds like you're really kind of putting everything together. It sounds like.
Yeah, I find I think the comprehensive approach as to why we get such significant changes that we get and a lot faster than other clinics. I know there's a popular overseas clinic, which I won't name, but I think it's like 3 to 4 times more expensive than we are, and they only do stem cells. That's all you get. You get there and they treat you with stem cells, and that's kind of it. And I've heard mixed reviews. You know, they've been doing it for a long time, so they're a good clinic in some regards. But I think our approach with the cell numbers that we use, with the administration that we use, with the other testing and treatments that we do, is why we get faster and more significant gains, is what we say.
Yeah, that integrative approach, just
Right.
taking out all the stops. That makes sense. So how did you, well, before I go to that question, what age tend to be the patients you work with in this autism category?
3 to 6 is really common.
Okay.
9, 10, 11 every now and then. I would say somewhere between 3 to 6, somewhere in that area is the highest. Yeah.
Okay.
There's that's also kind of a window to where developmentally any changes that you're making are going to have like a big profound effect. So we tend to see, you know, we've even seen as young as 2 to make a year and a half, I feel like. 3 to 6 is the most common. 7, 8, 9, 10, 11, 12 as well. I've done a couple adults. I've treated a couple early 20-something-year-olds.
And what were some of the results with the 20-something-year-olds?
You know, those were back when I first started. And that was before I was at my clinic. I was doing other treatments for somebody else. And they were good.
Yeah.
I remember they were good. A lot of times the subjective feedback you get from the parents may not be as black and white as they're talking. You know, like my son wasn't talking at all, and now he's talking. Sometimes it's just something the parent just notices, like there's a light behind their eyes that I could see, or they listen a lot better, or it's like this fog has been lifted from them. So those the older ones I did, I only saw them once. I only treated them once, and since they weren't they were my patients, but they weren't in my EMR, they weren't in my system. I don't follow up with them. I wish I still had contact with them.
How many therapy sessions do you typically need to do for people?
I try to emphasize and educate the families that this is good. What you're looking at doing is going to be over a year or two. You may start seeing results within the month or so, but you really need to plan on having this done over like a year or two. Maybe every 3 to 6 months is ideal. You know, there's no concrete like hard fast like an antibiotic regimen where you take 200 milligrams of this, 2 times a day for a week, and then you stop. It's just not like that yet. So, some of our patients we've seen 3, 4. We got 3, 4 treatments on now. Some do a treatment and they just wait. They want to wait. They want to see the effects of what's going to happen over a course of a year or so.
Okay. One thing I wanted to touch upon that I failed to get into earlier, but I really wanted to be able to discuss all the cool stuff that you do with MSCs is, you were talking about your research with Qigong and all the time and effort you put into that. How did you kind of find this niche with stem cell therapy and what you're doing today? What was that transition?
Man, it kind of found me. I really didn't go out searching for it too much. I knew it was a thing. At the time, I had, what I still do is very much like a concierge type medicine, where my patients pay me monthly for a certain amount of services, and that's what I was doing. And I told you I'd done orthopedic injections for a long time, and that was a specialty of mine. And so a clinic sought me out and said, "Hey, we need you to administer stem cells into our patients." And I said, "Oh, wait, I'm too busy. Like I can't really do that. It'd be nice to get into stem cell world, but I got my own thing going on here with naturopathic functional Chinese medicine and stuff." And I just gave it some time. They really, really wanted me. They offered me a great salary. I'm not gonna lie, that did help influence why I started working, doing it. And it didn't take long to fall in love with the medicine, because of the immediate gains that you can see. I was treating people that, had orthopedic problems, pain, whatever, for years, and within a couple weeks, it was like gone. That was really, really big. People on morphine. I remember I had a guy that he had broken down, and so he was on the side of the road, and I guess a car, wasn't paying attention, and they had veered. He had gotten out to like put his cones out and stuff, or call for help or something like that, and they had veered off and clipped and hit him, and he just tumbled over the car and everything. So that was like 10 years ago. So he was on morphine like daily.
Wow.
For his pain, and he was on the highest amount that his doctors would give him. So he was still having pain. And I remember I'd gotten him to a point where he had like no pain at all anymore. I think it was about after his second treatment. And I said, "So are you stopping the pain medication?" And he said, "No, I take a minimal dose." He said, "But I'm so conditioned to being on pain medication this long." He's like, I'm just scared. I'm scared if I stop taking it, my pain's gonna come back." I think he did eventually tapering off of it completely. But that just shows how strong it is. If you have somebody on morphine that is still in pain, and you can treat them with this kind of stem cell therapy, with this kind of medicine, and have that pain be like gone. So I was seeing some really, really, really good results. I started treating kids out of just desperation. I was just having people come to me and say, "Please, please, can you treat my kid with autism or some sort of congenital disease or something?" And I was like, "No." I was like, "I don't do that. I don't really, I'll be honest with you. I'm always on, of course, I'm always honest and transparent with my patients. I'm like, I just don't do that. I haven't done that before. I can't tell you if it's going to work." And the first one I did an intranasal treatment on a little girl that had a congenital illness. And the mom was just ecstatic. She said the kid started walking within like a month. And I left that clinic. So they hired me for a little while. I went and worked with their clinic, and I worked at my clinic part-time as well. As we discussed, as you know, I'm a workaholic. So that was horrible. But and after a while, I left that organization, and I came to do it full-time on my own. And it was the same thing, I was just getting parents reaching out and saying, I know stem cell therapy works. I trust you as a person and as a doctor. Will you do it for my kid? And yeah, so I said, yeah. 3, 4, 5, turn into a dozen, turn into 20, 30, 40, and it's just like, this just keeps getting better and better.
Yeah. How many people do what you do?
Not many. Not many. I mean, back to that transparency, I think there's a lot that are kind of, they're scared. The FDA doesn't make it friendly for us doctors. I'm not painting the FDA to be a big bad guy, but what they want to crack down on, the FDA just has a strong stance on people misdirecting, saying and this is a big no-no when I talk to my patients too, like stem cell therapy isn't going to cure autism. Like
Right.
there's a lot of places that try to make these big exaggerated claims. Stem cell therapy is going to cure your arthritis or your autoimmune disease or your autism, something like that. So really what they're looking for out is people that are making like a really bad name. But there is this weird little gray area where doctors are using things like stem cell therapy to treat their patients. And what gets tough is you can't tell a doctor how to treat a patient. I mean, somebody can get in trouble if I use a drug and I'm like, oh, this is going to be an off-label purpose. I'm going to use it for this condition. Oh my gosh, that went horribly wrong. I'm going to get in trouble from my board. But we don't have any side effects. We've never had any bad outcomes. At worst, we have somebody that doesn't seem to respond as well as somebody else, and that's
So,
rare.
so is there any contraindication to stem cell therapy?
Yeah, for me, it's cancer.
Okay.
I'd say not quite maybe a contraindication, but there's just things it's not going to work for that I get people contacting us about. So somebody may call me or call us and say, is it, I have back pain. Well, what's the source of your back pain? Oh, I have scoliosis. I'm like, well, it'll probably help with the pain from the years of those damaged joints and stuff like that, but it's not going to correct that curve of your spine. Some congenital diseases, things I don't know if it's going to work on. And so I just tell them that, I haven't treated that a lot. I've seen it like 2-3 times maybe, or I haven't treated it at all. So not quite a contraindication, but I stay away from cancer. I think it's best to be cancer-free with at least 6 months. No melanoma. Some cool research by Dr. Arnold Kaplan, who is like the grandfather of stem cell therapy. He named mesenchymal stem cells, and he has even written and given talks, and he's written a position paper on how they named them wrong back in the 70s, 80s or something. Mesenchymal because of the tissue source they thought they came from. He wants to change their name to medicinal signaling cells because that's what they do. They signal, they make medicine, they signal your cells in your environment, in your body, to basically be healthier. And so he's a very strong advocate of renaming them. But he did some research on how melanoma can literally grab stem cells in the environment and use them for their purpose of spreading. So melanoma is a big no-no. Cancer in general, just to be safe, I try to stay away from unless they've been cancer-free for a while. But you can also break it down. If it's like they've had cancer like 6 months ago, but I'm doing a knee injection, that's a little different. I'm more comfortable with that versus somebody that may want to enter it systemically in their body. And I'm like, well, you may want to wait. I'd feel more comfortable if your oncologist, said that you were cancer-free and there's nothing to worry about.
Right.
But very little contraindications. It's very safe.
Okay. So there's still just so much to learn, it sounds like, but I feel like that's a lot of, for most cancers, especially, like there's kind of that you don't know how things will react. So it kind of sounds like it's in that category.
If cancer wasn't tricky, we'd be curing it left and right a lot more, but
yeah. So I think this is something cool that I learned about your practice. Why don't you tell people the process of actually getting the stem cells? I know you mentioned the source, but like, how does it work from, say, when you get it from a umbilical cord to, what's the process from there to the actual injection?
I don't know that as well as a stem cell biologist. I'm a little savvy on it, just from dealing, talking to our stem cell biologists and others. But from so my version is is the core adapter is tested and everything. It's basically kind of, there's a couple ways you can do this too. Mechanical or enzymatic digestion. Mechanical, I've heard, is a little better. From what I gather, that's exactly what I asked the stem cell biologist, was like, is it sound like you're just putting it in kind of like a Vita blender or a Vitamix? And he's like, yeah, kind of. Like, they grind it up so much that it's basically like this just gelatinous little gel almost. And then they use enzymes to break away and melt down like a lot of the tissue. And it's probably one of those things where there's like different ways to skin a cat. There's probably like different ways to harvest stem cells, but yeah, eventually you get this sample. You get your sample after you've broken down a lot of the tissue that you don't really want, and I think you stain or you put markers and growth factors in there that help isolate these specific kind of cells, and then you add this to what's called a media or a medium. And you can do this in a flask, or they make special plates that you do this on. Like, remember in like biology class, like where you had an agar plate and you could grow bacteria on it and stuff like that. Kind of the same thing. They have special ones just for MSCs. And so you put in the nutrients and stuff that they need. You put in stuff like antifungal and antibiotics, so that it doesn't become contaminated. You run samples to make sure you have the right cell type, and then you just leave them there to grow and do their thing. And then they check the samples periodically to make sure the morphology, even like how the cell looks. They'll take a cell a little bit, put it under a microscope, and they'll make sure the cell is growing right. And so super detailed, the work that they do.
Yeah, it sounds like a very involved process to get to that point, but it sounds like people are very willing to, with the results they're getting, it sounds like people are very willing to be like, hey, I want to give this a shot.
Oh yeah.
And then, so, okay, what is like the market range for something like this? The market range for therapy like this? Does insurance cover it? Do people pay out of pocket? Is it only available to people in the United States, who, for your clinic, for example? I was curious for other people, whether it be an athlete, whether it be a parent, whether it be, someone just trying to help with their pain. How do people pay for this? Like, what's the usual market cost? Is this something insurance covers? Like, how does all that work?
Yeah, insurance very rarely covers it. I think they cover it if you're post chemotherapy.
Okay.
And you're doing it. I'm not in the insurance game. That's hard for me to answer. I've never done insurance. I ran a cash practice from day one. I've always been involved in, even right out of medical school, the first clinics I worked with, I've always been involved in cash practice. So I'm not strong on the insurance route. I did have a patient get some sort of reimbursement one time for it. He said he just kept billing the insurance companies, and he said it took a lot of phone calls, but he got, I think, part of it covered. But for the most part, I don't think I've ever heard of people having it covered. There is a little bit of a scam going on that I've heard from other doctors, where Medicare, I think, will claim to cover it. And this is more of a warning for the doctors, if any are watching. Medicare will claim to cover it, and then a little bit further down the road, they will be asked for reimbursement because it's not technically covered.
Okay.
So I don't know. I've always done a cash base. The patients that come to me don't want to deal with insurance anyway, so it's like a win-win for me. They don't really want to deal with insurance. They don't like insurance anyway. But yeah, unfortunately, I know a lot of people that's what they have. But yeah, the cost depends how much for me and the plans we do, how many cells we're using, how many labs are we doing, how many visits are we doing, and that runs anywhere from 6,000. I guess it could run less. If somebody just wants like a small joint treated and they just want one treatment, just ends up being the amount of cells that we're doing. But I have treatments all the way up to like 30, 40, 50,000. Those are big, like year-long plans. Whole body kind of rejuvenation treatments where we're hitting like a lot of joints. We're hitting like an anti-aging kind of a approach where they're getting cells for like a long period of time. So anything in between there, it just depends on what they're getting treated and the specifics of that treatment.
Okay, so it sounds like it can vary all over the place, just kind of based on...
It varies. Since we do a lot of autism, that tends to fall anywhere from 8,000 to 23,000. So we have patients where other clinics overseas tend to charge $20,000 per visit. So what we do is we charge $23,000. I guess I should say 20 to 25,000 because sometimes these other clinics they give different prices to parents. From what the parents tell me. So we have a plan where we treat over a year with a certain amount of cells, and whether that's 4 treatments, every 3 months, whether it's 6 to 8 treatments spread out over like 2 years or something. We've done $30,000-$40,000 treatments where it's very, very anti-aging focus, scalp, sexual function, facials, joints, intravenous, intranasal for brain health. So yeah, it just depends.
Wow, that's all over the place. That's crazy.
Yeah. Some places are very niche. They only focus on one thing. I've done so much stuff over the years, and I have a team and staff and stuff that's growing, that we can do, a bunch of different stuff that we're capable of.
Right. Well, that's really cool. So, all right. Well, before we finish up here, I want to also, provide some like resources for people. Where can people learn more about this?
InnateHealthcare.org, INNATE healthcare.org. We have a bunch of research if the people are interested in that. We got a blog.
Okay.
I try to get to as often as I can to write. Our website is pretty heavy on the info.
Okay.
We do phone calls, if I can. 602-603-3118 is our office line. So sometimes I'll just do quick 10, 15-minute phone calls just to knock out like questions for patients. People just sometimes want to know, like, this is my problem. Can you help? Can you help with it? Or is it something you've treated before? And I either say, no, no, we haven't seen that a lot here. Or yeah, we've done plenty of those. I can give you expected outcomes of when you'll see changes, and we get really good results with it. So a lot of times people just call in just to, ask about that. We don't take insurance, so don't schedule an appointment if you think we take insurance, because that happens every now and then too.
So any areas that you think we should discuss, or any parting thoughts from you regarding anything we discussed before we finish up?
No, I say save it for the next talk.
All right. Well, I appreciate you taking the time today. I think this
Hour
was
and a
really
half is a
great.
lot for people to watch. We can, I mean, we can talk for
I know.
hours.
I know. We're gonna
Um,
have to
but yeah, we
break
have
it
a
up.
couple of different topics I think we can cover if you're up
Yeah.
for it.
Yeah, absolutely. So those of you listening or those of you watching, Dr. Whitney and I will be having further chats in the future, I'm sure. So we'll save those for next time.